Good evening. I'm Professor Nick James. I'm Professor of Oncology at the University of Warwick and Consultant Oncologist at the Queen Elizabeth Hospital in Birmingham. Been talking today at the RSM meeting about the STAMPEDE results which just got published in the Lancet just before Christmas. This was from three of the original arms in STAMPEDE. So the control arm in STAMPEDE is hormone therapy alone with or without radiotherapy for locally advanced disease. And we added to standard therapy either docetaxel, zoledronic acid, or the two drugs combined. So we presented the results of this first at ASCO last year and then updated results in Vienna in September and published the results in December. So what the trial showed was that the addition of docetaxel to standard hormone therapy improved the survival times by around about 25%, just under 25%. When we looked separately at the metastatic and non-metastatic patients, we actually had remarkably few deaths in the non-metastatic ones, largely because of the use of radiotherapy in this population, which has increased the survival time substantially. In the metastatic patients, average survival went up from about 45 months on standard therapy up to 60 months with the use of upfront docetaxel. So this is quite a big benefit. Two other trials have looked at this same population, the metastatic newly diagnosed. A French one called JETUG 15, which was negative but with a trend towards a survival improvement, and an American trial called CHARTED, which was also published last year in August in the New England Journal of Medicine. CHARTED showed a very similar survival benefit to STAMPEDE. So the second paper we published, also in December, was a meta-analysis of all of the relevant trials for docetaxel in metastatic disease and non-metastatic disease. So the meta-analysis showed a trend towards improved survival in M0 patients, but not quite, even with the meta-analysis pooled data, enough to hit statistical significance. But the meta-analysis of the metastatic trials very convincingly showed a survival advantage. The other drug we looked at in the trial, zoledronic acid, rather surprisingly had very little in the way of tangible benefits. There was a marginal improvement in failure-free and overall survival, not statistically significant. We also looked at this in the meta-analysis, and that also convincingly was negative. So we concluded there was no role for upfront zoledronic acid in metastatic or non-metastatic prostate cancer. We discussed all of these results with both NICE and NHS England, and in parallel to us preparing this for publication, we were working with those two bodies around changes in policy. So I'm very pleased to say that NICE published a rapid evidence review first week of January, essentially coming to the same conclusion as us from their look at the data. They also concluded that because of savings in delayed relapse and lower rates of skeletal complications with docetaxel, that the actual cost of delivering the treatment was pretty much cost neutral. It was maybe about £1,000 a patient. NHS England are about to publish a policy statement recommending the upfront use of docetaxel in suitable men with newly diagnosed metastatic disease. So it's nice to see the trial results translating into a change in NHS policy hot on the heels of the publication coming out. So thank you.